How to correct lopsided hooded eyes. I am unsure of exactly what makes my eyes do this, which is why I don't truly know what I need. I've heard simply Botox for my hooded lids or an endoscopic brow lift, but I'm not sure. It's like my brows are lopsided, or one eye is severely hooded and the other isn't. Please let me know what I need to correct this. It's awful and shows in every photo.
Thank you for your question. You have submitted several photos, basically the same position, and you describe in your question that you are concerned about the hooding on one eye compared to the other, and that you are trying to figure out what to do about this, and that you're lopsided. Questions about Botox or brow lifting or what to do. Well, what you have experienced essentially is the realities that we all have is a certain amount of asymmetry. And so there's going to be a difference, so for some people more than others. There are very few people who are truly fully symmetric or maximally symmetric. I always say that we're beautifully imperfect. I've been a practicing cosmetic surgeon for over 20 years, practicing in Manhattan and Long Island. And so in situations like yours where somebody has more hooding on one side compared to the other, the general approach that we do is offer the option of doing a blepharoplasty, which means to shape the eyelid so that the eyelid goes in to improve the symmetry. We can rarely make someone 100% symmetric because the reasons for this asymmetry have to do with the soft tissue as it lays on the bone, on the actual structure. So the bone structure is a very important part of this asymmetry. But what I can't do with just photos is do something we do when we do our consultations. And that is we'll use a Q-tip or a little eyelid creasing instrument to push back the eyelid skin and see how they would look if you were to have a blepharoplasty. And that guides the patients as to whether or not they want to pursue that option. There's another approach where when I look at your face where the left brow is higher than the right, and one can consider Botox on the left brow, but then there would be an asymmetry when you're raising your eyebrows. You're young and it's unusual to have this type of lack of activity in the forehead. It's certainly different as you get older. So, and of course, as a younger person, I'm not sure it would be feasible for you to continue to do something on a regular basis like Botox. So in situations like yours, I have treated patients with what's called a cosmetic upper eyelid blepharoplasty, typically only on one side or unilaterally, and they've been happy to see at least they can apply eyeshadow and it balances between the two eyes. The thing I can't tell you definitively is without a physical exam, I can't see how much the skin would go in and how much fat soft tissue would be able to also manipulate to try to maximize symmetry. So I think meet with some doctors and learn about this option and get the eyelid creasing done to see what you can anticipate so you can have a sense of what the outcome will be. So I hope that was helpful. I wish you the best of luck, and thank you for your question.